Okay, so this talk today is called or about how Parkinson's can affect speech, swallowing, and voice. A little background here. Actually, Rick has kind of covered some of this, but this is a visual for some of you who might be new to Zoom. The mute here, we ask that everyone's muted for the main part of the talk, just because we're recording it. We want to keep background noise to a minimum. If you choose to be on video, feel free to click this so that the red dash is removed and that you are on video, but you're welcome to stay off video, especially if you're having your lunch. And then like Rick mentioned, you can just click on the chat box if you have questions that pop up while you're listening and things you want answered. Feel free to do that, and we'll do live Q&A at the end as well. So that's just a general overview of Zoom. So my name is Sarah Talach. I'm a practicing speech language pathologist for 15, almost 16 years now in February. I completed my bachelor's in speech pathology from Cal State Chico, and my master's also in speech language pathology from the University of Pacific in Stockton, commonly known as UOP. My career has ranged from working with adults in various hospital settings. That's where I started my career. And then in about 2010, I transitioned to working with children and then still working with adults in a hospital setting, kind of on the weekends. I have a personal connection to Parkinson's. My father, Matt, who you'll see a picture of next, was diagnosed almost 2 years ago in 2019 at the age of 61. And that is what led me and inspired me to start my own private practice, which is kind of getting off the ground this year, in Talach Speech Therapy. I live here in Walnut Creek with my husband, our two sons, and our golden retriever. And I joined the Parkinson's Network Board of Directors in January of 2020. So I am the membership chair and the current acting secretary. So I kind of have a couple hats that I'm wearing at the moment. So this is my family, and that's my father, Matt. So getting into the talk today, and feel free, please don't worry about writing down notes. I will make this PowerPoint available to everyone, okay? We'll post a link to the deck, or we'll make it available to you through our website, through PNMD. So feel free just to listen, and you'll have access to all of this later, okay? I know it can be a lot to multitask. So in general, an overview of speech and voice characteristics of Parkinson's, as many of you may experience, is that you speak a little quieter, a little softer. Your voice may feel a little more monotone now, meaning you don't have a lot of, you just kind of have that one tone when you're speaking. And you might find yourself a little monopitch, which means it's hard to convey emotion in your voice, which, sarcasm, humor, emotion, those types of emotions may be harder to convey. And you may find that your voice sounds a little breathy or hoarse, just a little, if you've noticed some changes. Let's see, why is that? Okay. Some of you might also experience or have been told that your speech might sound more slurred or imprecise. It may sound mumbled or kind of trail off at the end of a sentence. And some may experience just a slower rate of speech in general as they're trying to get their thoughts out and communicate. And others may experience rushes of speech. It kind of almost sounds similar to stuttering in a way, where it's difficult, like popcorn. It's hard to get a word out. And that can also be a side effect of with Parkinson's. So some questions to ask yourself if you're kind of wondering, and if you're here today for a reason, because you want to learn more, and hopefully you do today. But things you might be considering is, does my voice make it difficult for people to hear me? People have difficulty understanding me in a noisy setting or room, if you're maybe in a restaurant or somewhere busy. If you find that your voice issues are limiting you personally and socially, and that you feel that that's having an impact on you. If you're feeling left out of conversations because of your voice. There's a woman in my hometown who's been living with Parkinson's for over a decade. And she had DBS done a number of years ago. And a close friend of hers shared with me that they have a very hard time communicating on the phone anymore. They pretty much have to rely on text because of her voice. So that can be a real side effect of Parkinson's, unfortunately. If you're still working and in the workforce, is your voice causing you any difficulties at work or impacting your job? Or do you feel that you're having to strain to produce voice and really even just get your voice out? Let's see. Some other things to consider is your voice clarity kind of unpredictable? Is it coming and going? Is it upsetting to you or to your loved ones? Does it make you feel like you have a disability or you're handicapped by your voice, that it's preventing you from meeting your functional communication needs, ordering, filling a prescription at the pharmacy, day-to-day tasks? Or are people asking you, what's wrong with your voice? You sound different, if you're getting that kind of feedback from folks, especially people who don't know you. Some of the ways to treat speech and voice problems is to seek the counsel and help of a speech language pathologist. We are trained in evaluating and treating people with speech, swallowing, and voice and language problems. Some of us specialize in working with adults and others children. So you definitely would want to connect with someone who has experience working with adults. And you can get a referral through your primary physician or your neurologist or someone within your health network of however you're connected with your insurance. You also want to consider before you get going into skilled speech therapy, if you were to be evaluated and speech therapy was recommended, and especially if you are of Medicare age and receiving Medicare benefits, there is a cap each year Medicare puts on skilled services, like physical therapy, occupational therapy, and speech. So you want to make sure that you have enough benefits, enough dollars, I guess, left for the year before you take on speech therapy to avoid any unforeseen bills, especially if you've had PT or OT in the same year. That's mainly the concern. And the programs out there that some of you may have already experienced personally, the Lee Silverman voice treatment, LSVT, commonly referred to as, or Speak Out are both two voice programs centered around helping folks with Parkinson's improve their communication. First, we'll talk about LSVT, which has been around many, many years. I learned about it in grad school, almost 20 years ago. So it's been around a long time. And it was one of the first proven programs to significantly help folks with Parkinson's improve their voice. The exercises are, found to have an immediate impact on one's communication. I personally am not trained in LSVT, I'm not a certified provider, so I don't know the ins and outs of it as well, but I do know a general overview of the program. Lasting effects have been shown to last up to 2 years following treatment, but that said, you need to practice along the way. You need to keep up the practice, like many of these programs. LSVT has also been found to help folks with multiple system atrophy, as well as PSP, or progressive supranuclear palsy. So other types of communication voice problems associated with those disorders. LSVT kind of has I don't want to use rigid in a negative way, but it has a very set protocol that you do 4 days a week for 4 consecutive weeks. I believe the sessions are 45 to 60 minutes each. And the days you are in treatment with your speech pathologist, you would still practice one extra time that day at home. So twice a day while you're in the active treatment. And then you would go do daily practice on your own after you've completed the 4-week course. And it's recommended to schedule a 6-month reevaluation with your specialist or speech pathologist who taught you the program, just to monitor the impact on your voice and to make sure if you need to have a refresher or any additional support is needed. I'm not aware in our area. I did a little search to see if there was any groups, but I didn't come up with any. But there may be. You can check with your health group if they have an LSVT Think Loud, I believe, or Loud group that they call it, so that it's kind of an ongoing weekly that might be happening or available to you, and even now online in our virtual world. What's often recommended with these voice programs can be a digital sound level meter. So here you see an icon of one that's more of an older one, often produced by Radio Shack many, many moons ago. And this is one way to measure the decibel, like the volume of your voice. And now there are a number of apps that you can use through your phones or tablets to help you measure your decibel level. And usually a conversational range of volume when you are trying to maintain is 68 to 74 decibel. So it may seem loud to you, but that for someone to hear you, you kind of need to be in that range. Here I list some other voice kind of decibel meter apps that you can use through your smart devices these days. And one thing to keep in mind, I don't have this on a slide, but it popped in my head, is with Parkinson's, there's a sensory component to it. So oftentimes when you're communicating, you feel that you're talking loud, and in your own head, it sounds like you're very loud. But the reality is you're probably not as loud as you think you are, especially judging by how well someone's understanding you on the receiving end. So there's kind of a sensory disconnection, and the perception is altered by the disease. So you sound louder in your own head, and you have to kind of force yourself to use your voice a little more than you normally would. So you have to come to terms with that and managing without straining your voice, but finding a way to be a little bit louder. And you'll know by your communication partners and their response. But to just know that that is a side effect or a part of Parkinson's. Now Speak Out, this is kind of an overview of how they run their program. So start with a speech evaluation. They have information sessions, which can be held in person, or they have a recorded video. You do the treatment, usually 8 to 12 sessions, and then they recommend a 6-week follow-up to see that you're on track with your goals and maintaining your goals. And then they offer, many providers offer a Loud Crowd, kind of an ongoing follow-up weekly group. And they also are currently streaming Facebook Live speech practice sessions for folks. Since COVID hit, they went to a virtual, so they have weekly live ones, and they also have recorded ones available through their website, which you'll find at the end of this slide deck. Parkinson's Voice Project is the brains behind the Speak Out program based down in Texas. It's a nonprofit that operates under a pay it forward model. And I'll get into that on the next slide. So as I explained, they have you must kind of go through their information session so you know what you're getting into and a little bit more about Parkinson's. And then it typically consists of 8 to 12 individual sessions, depending on the individual and their needs. So Speak Out provides a workbook for those who are participating in the program, and that's where the pay it forward model comes in. If you were to call them and say, hi, my name is John, I'm working with such and such speech language pathologist here in the Bay Area, and that person is a certified provider, then they will gladly take your information and mail you a workbook free of charge. The pay it forward part comes in, they will then send you a nice card explaining if you would be willing to make a donation to their nonprofit to pay it forward and to continue this model of everyone receiving services. So they do ship the workbooks free within the United States. The crux of the Speak Out program is speaking with intent and using your voice in a different way. And we're going to get into that in the next slide. As I mentioned, the Loud Crowd is kind of a weekly ongoing group that builds camaraderie and accountability, and where you keep practicing together as a group. This is kind of the crux and the meat of the Speak Out program and why speaking with intention is so important for someone with Parkinson's. Parkinson's is kind of a disease of the extrapyramidal system. So here on the left, you see that there's kind of this busy highway of circuitry in green. The substantia nigra here, these little purple markers, are the midbrain of your brain. And so this is where the dopamine is housed. And as we know, with Parkinson's, there's a lack of dopamine. Often, 70 to 80% is depleted by the time you're actually diagnosed. So you're working with a limited reserve. That's why many take L-Dopa and those types of medications. So with this circuitry, this is how you used to do things on autopilot. And And this is how you communicate without really thinking about it and putting any little effort into it. It's just your normal voice. So Speak Out teaches folks to speak with intent in order to activate the pyramidal system of the brain. So this is more of your intentional system. So you're tricking your brain to get off autopilot and to say it with intent, and then it cuts down on the circuitry needed, and it's far less taxing on the brain, and yet yields positive results in your voice and your communication overall. So that's kind of a general overview. And this applies to many things in your life. When you do things automatically and you're not thinking about it, you might find it's trickier. You're just trying to do it on autopilot. But if you're going to move or swing a golf club or do something, activating the pyramidal system and that intention can make a big difference and possibly make things far easier for you. Some general differences between LSVT and Speak Out. One is not better than the other. They just have different focuses. So as I just explained, Speak Out is more about using intent and activating the pyramidal system of the brain, where LSVT has a focus on being louder and increasing the volume. And they have some differences. I won't bore you with all these details, but we've already covered differences in frequency and the programs in the practice and the protocol of each program. And both do require ongoing practice, like anything. If you go to the gym, you have to keep it up. You have to keep using your voice and practicing daily, at least once daily. And they both require that you follow up with someone, within 6 months to make sure you're maintaining your voice. Next, we'll get into swallowing problems associated with Parkinson's. Many of you may have already noticed changes with difficulty chewing, maybe eating, or the actual swallowing process when you go to swallow certain types of foods. And this can happen at any time. For some, it can be early in the disease process, and for some, it can gradually kind of creep in. So similar, as you can imagine, swallowing and speech use overlapping muscles. So our face, our mouth, our throat, they're kind of intertwined. So we use them for both, and that's why there can often both be affected with Parkinson's. The technical term for swallowing difficulties is dysphagia, which maybe you've heard of this term before from your physician. And it can be frustrating or embarrassing for some folks if they're having a difficult time with eating. More importantly, though, some of the downsides to dysphagia would be malnutrition and dehydration, and ultimately aspiration, which we'll get into a little further on, when food or liquid goes down the wrong pipe and into your lungs. And aspiration is one of the #1 causes of death in Parkinson's because it can develop into an aspiration pneumonia, unfortunately. And a silent aspiration is when maybe food or liquid is trickling down into your airway, to your lungs, without a cough or a reaction from you. So you may not even be aware that it's slipping down. It doesn't trigger that reaction. To know if you've had a swallowing problem, you may kind of consider if you've had any recent lost weight, if you're losing weight and you're not trying to lose weight. If you find yourself avoiding drinking liquids, maybe you find that water has become a little too hard to manage and it's making you cough or choke, that might be a red flag that you should seek some counsel. The sensation of food being stuck in your throat, which is a very annoying feeling, and you may have that. You might also find that you're tending to drool more than you would like to. And I don't mean just at night, I mean during the day where you feel it kind of in the corners of your mouth. And that can be from a lack of swallowing enough. You might also find when you're eating, particularly certain foods, that you might have pocketing in your gum line between your cheeks and your gums. There's these little pockets in our mouth here, and you may find that food is collecting there and you have to do like a little sweep with your tongue or even your finger at times, depending on the food, to get it out of there. You might find yourself coughing or choking during, before, or even after you've ate or drank something. If you're experiencing heartburn or a sore throat, that may be a sign of gastroesophageal reflux disease, commonly known as GERD, and that can sometimes, unfortunately, come along with dysphagia. Or you may just find you're having a hard time keeping food and liquids in your mouth. Any and all of these things can be a sign that you might have something going on with your swallowing. Again, similar to speech, you should get yourself to a speech pathologist. Again, referral through your physician or neurologist. It would involve a medical history. They'd kind of know what you're eating, what you're experiencing, you know, get an overview of your dentition, all of those things if you're missing any critical teeth. And then you would most likely should follow through with a video x-ray. So a modified barium swallow study, and some of you may have already experienced this in your lifetime, which is under x-ray, and food is kind of loaded up with some barium so that it actually shows up on the x-ray, or a fiber optic endoscopic evaluation, which is also commonly known as FEES. And that is a flexible scope that goes down your nose to your throat and kind of looks a top-down angle as you're eating and drinking. Before I show you this video, I'm going to give you just a general idea. This is kind of what you're going to be looking at in the video. It will show you a normal swallow. It will show you a swallow with aspiration. So where here in the front is going to be your trachea, your airway, down to your lungs. And here, just right behind it is your throat, which should take the food down to your stomach. So in a normal swallow, that's where we should see the food go. And if it's an aspirated swallow, we're going to see it go down the wrong pipe. So let me load this video here a moment. So this is a normal swallow, and it's going down. And this swallow is silent aspiration. So it went down the front, down the trachea, and silent meaning there was no cough from the individual. They did not sense that it was going down the wrong pipe. So that's kind of an overview. If you were to go through a modified barium swallow study, they would be looking for these things with different textures of foods and liquids. Some different ways to treat swallowing problems can be LSVT or speak out. They both have been proven to help folks improve their swallow function. There's also expiratory muscle strength training with a little valve-like device that can help strengthen respiratory muscles, improving your cough and your strength, and also as a way to help protect for aspiration. When we cough, when food goes down the wrong pipe, that's our body's way of protecting the airway. So that cough is trying to keep that food or liquid from penetrating and going in. So you want to have a strong cough in order to have that protective mechanism working. Treating swallowing problems, when you meet with a speech pathologist, he or she may recommend changing your diet, and especially based on a FEES or an MBS type study and what was observed in either of those instrumental studies. Softer foods, possibly things like pudding. I mean, these are just examples. There's different classifications of diets that may be recommended based on the textures. As I mentioned, related to drooling, this is a kind of a common problem for folks with Parkinson's. So you tend to swallow less often and less completely, which then leads to more saliva kind of pooling in your mouth, and it needs to go somewhere. So unfortunately, it likes to creep out to the corners of our mouths. 70% of folks with Parkinson's have been found to have too much saliva. So sucking on a hard candy, something that works with your diet, and if you're sugar-free and all of those things, keep that in mind. But it can help stimulate more frequent swallowing and may help you manage the drooling. Another effective treatment, I do not know anyone personally who has tried this, but I came across this in my research, is atropine eye drops that can be apparently very effective when dropped under the tongue. But as anything, always check with your physician first if this is recommended for you and if it would be advised. Next, we'll talk about deep brain stimulation, as many of you may have experienced this or you may be considering this in your journey with Parkinson's. And this is a common, can have some effects on the voice, and is often something I've heard from folks who have personally gone through the procedure. So it's used to treat essential tremor, Parkinson's, dystonia. So it's used for a variety of reasons. Some of the benefits to DBS and why many of you choose to make that decision You know, it can decrease your tremors and your rigidity and the stiffness. It can help decrease medication and increase your mobility and your overall emotional well-being and your independence with daily living activities. So these are all great things. It can be reversible and adjustable, and it's been shown to have longer, you know, survival rates and greater independence for folks living with Parkinson's. Well, as with everything, there are some drawbacks. You know, there can be surgical complications, possibly increased freezing of gait or postural kind of, you know, instability, some balance issues, and it can possibly exacerbate some preoperative cognitive disorders. So executive dysfunction, in the research, you know, there can be changes of impulsivity or possibly one's processing speed. The programming and the placement of DBS, and maybe some of you have experienced this personally, may have an impact on your speech and voice. So a higher amplitude or higher frequency may be linked to this deterioration if you've noticed a change in your voice after the procedure. But that level of amplitude or frequency may be required to improve your motor performance. So sometimes it's a bit of a trade-off. There are two types of placement where they place them, the probes for DBS. So STN, which stands for subthalamic deep brain stimulation, and then GPI, which is globus pallidus interis. In the research, and there's still more to be done, the GPI location has kind of shown to be less compromising on one's overall speech intelligibility. Not to say there can't be changes, but maybe a little less drastic than the STN placement. And this is just kind of a lot to take in, but if down here is where the probe, the placement would be for STN, and then the GPI is here in the globus pallidus. So just a different spot of the basal ganglia in the middle of your brain. And then the substantia nigra is right here, these two areas. So that's where the dopamine is housed in your brain. So they're in the general vicinity, but just slightly different locations from one another. Let's see. So also another thing to keep in mind is that with DBS, left-sided stimulation may also be, or unilateral, only one-sided placement versus the other, or versus bilateral, both sides, may have a different or more negative effect on one's speech. So if you're considering doing DBS, I would maybe consult your neurologist about your options and what is recommended for you, and just, you know, something that you now know to consider. DBS can affect the voice, and you know, you may find that your speech is more slurred, or you've lost that precision, intelligibility in your voice. You might experience a decreased overall speech intelligibility, where people are having a harder time understanding you, or there can be those rushes of speech, kind of that stuttering-like speech, where you kind of get going and it may be hard to slow down at first as you get your thoughts out. Some may experience a slow rate of speech, monopitch, monoloudness. So similar to all the types of symptoms of dysarthria with Parkinson's, but you might find it's a little more exacerbated for you after DBS. And there might also be difficulty coordinating respiratory, your breathing and your speech. So your breath and your speech, you need your breath to speak. And so that if that coordination is altered in any way, you might find your voice is a little breathier or hoarse and harder to produce your voice. So some things to keep in mind if you're going through any kind of speech therapy or voice program after DBS is that spontaneous speech might be a little bit more challenged than if you're doing your structured tasks in that program, or your daily practice of any kind of speech therapy exercises. Some folks are a little dissatisfied with their voice after DBS, but again, it's kind of one of those trade-offs. You know, to have the improved motor function, sometimes there is going to be a trade-off with our speech. It may take greater effort to achieve your goals. It can be done, it just might take a little more work. And then also keeping up with your therapy is going to be probably very critical to maintain any progress that you make. So do that daily practice. Some other things I came across in my research. This is your vocal cords. This is the real life pictures you can see. So collagen injections have been used for folks with Parkinson's. These two white strips are your vocal cords, and there's a slight little opening here. Normally they would come together all the way. So if you have any issues with vocal folds not closing completely while you're speaking, but they're still functioning well, collagen injections may be beneficial for someone. You would need to consult with an ear, nose, and throat ENT, otolaryngologist, for this type of procedure. It's usually low risk. Anesthesia is not needed. I believe it's just done outpatient in the clinic. It would inject directly into your vocal cords, into your folds. They would do it externally. The effects can be up to 6 months. And it can work for a lot who do have fully mobile vocal folds. They're moving together and symmetrically, but maybe there's a little weakness in how well they're coming together, and that's causing your voice to be breathy. Some assistive technology devices that are out there in the marketplace, and these are links for you when you get the PowerPoint, so you can click on these and get more information, is a personal amplifying device, which can be something you wear that you can amplify your voice. And there's even probably some that are more of a lapel type mic that you could use to project your voice. There's also delayed auditory feedback. So this would help for someone who's maybe experiencing the stuttering-like symptoms of the dysarthria with Parkinson's. And it's a delayed loop that you hear yourself and an echo of yourself, and it helps you slow down your pace of speech. It's been very effective in stuttering treatment, aside from just stuttering in general, not necessarily specific to Parkinson's. It takes a little getting used to, but it can be helpful for folks. There's a number of text-to-speech apps out there for folks who are still typing and need to just, get their message out effectively. So these are some examples here, and I found some of these images to show you. So a lot of them are for Android or Apple devices, if you wanted to put one on your phone to help you out in a moment. The Speech Vive is this little device up here that kind of looks like an old school Bluetooth that we used to wear in the 90s and 2000s. So it kind of clips over the back of the ear, similar to a hearing aid. And this is something that creates an increased volume when someone is wearing it and they speak. So it forces you to speak over the background noise that it's created by the device. So it forces you to use your voice louder and to compensate and be heard over that. And then when someone is speaking to you and you're listening, that noise disappears. It's a fairly new device that came out from Purdue in 2019. And then Speech Easy is also another kind of feedback device, similarly worn like a hearing aid, and that's more for the dysfluency and the stuttering like that some may experience with Parkinson's. So just tips in general for your voice and to maintain your speech. Is exercise your voice by reading aloud or singing. You kind of have to use it or lose it. Unfortunately, you have to keep it going. Staying hydrated is very important. I'm sure your doctors have said this. I know with my own father, this isn't something I'm harping on him about a lot, to stay hydrated. And so I found this information here, daily recommended intake for men and women from the Mayo Clinic. For coping with the speech difficulties, you can also, train your voice kind of, as you would with any program. So LSVT or Speak Out are great examples of ways to train your voice and to try to maintain your voice in those programs you can seek. Getting feedback from your loved ones and family members, how you're sounding. Maybe they give you a cue, you guys come up with a little gesture or something to kind of remind you to speak louder, especially if you're having a hard time being heard in a public setting. A voice amplifier, may help if you have soft speech, especially in a noisy environment. It will not help with mumbling or the stuttered type speech, but if you just are experiencing a softer voice, it may be very useful. Some other tips to keep in mind is making eye contact with whoever you're speaking with. I mean, this is kind of general communication, but it's especially important if you're having a harder time being heard by others. Background noise is key. If your loved one is having a hard time hearing you at home and the television or the radio is often on in the background, that's an easy solution by turning that off. You may find it easier to socialize in smaller groups, one-on-one. where there's less competing noise. With Parkinson's, as many of you probably experience, there's a masked type with the face and the rigidity in the facial muscles. So sometimes it's harder to convey your feelings and your emotions. So using those words like I'm feeling excited or I am feeling happy, your face may not say it. So you might have to actually verbally provide that emotion, or using gestures that can offset it so that others can understand what you're trying to convey. And then find out what times of day your speech is best. If you are not a morning person, your voice may be stronger at the end of the day. And that might be when you want to plan more of your social outings. Some tips for masks. This is from our the American Speech Language and Hearing Association that I'm a member of. Again, making sure you have your communication partner's attention. You want to face directly so that you can see each other. With a mask, as we've all experienced, you're going to have to talk a little bit louder, possibly a little bit slower. You may also need to use your hands or your body language. And you might want to check in to make sure you're being understood if someone's having a hard time hearing you through a mask. And if you need to write it down or possibly use one of those speech apps to convey your point. A quiet setting, again, background noise is not going to help your cause if you're having a hard time being heard through a mask. And also just checking in if it's someone new, if they're having a hard time understanding you, and just letting them know what can we do, to rectify this and improve the communication. This is my contact information. If any of you have any questions at any time and you want to reach me, feel free to give me a call, send me an email. I'm happy to try to help or answer any questions you may have. And then I have a list here of all the sources of information, and these are all links. So when you get the copy of the presentation, you can click on it and it will take you to the articles and to the information if you're curious about that. I'm going to stop sharing here. Okay, so I'm a little over time, but that is a wrap on my presentation. So I think we're ready for Q&A.
Hey, Sarah, can you pop the slide up again with your email address and phone number? And then I'm going to put it in the chat so everyone could copy it out if they have that ability.
Okay, all right, let me see here.
Sarah at. Okay. Oh, let me get this. Talach speech. Ooh. Therapy. And then if anybody wants to type their questions into the chat for her. So I put the email out there.
Okay.
Phone number 925-232-1868. Okay.
Okay.
Thank you.
No problem. Thank you, Jody. Okay. So do we have it, Rick? Do we have any questions?
Well, now we're ready for questions. No. The only person I have from the chat who actually made a comment so far, besides me or Jody, was Steve W., who said he's taken LSVT twice, but it only has lasted for a few months. So you might want to comment on that. And then as people want questions, if you want to ask a question without typing, because I know that could be difficult, click on the participants button at the bottom, and where it says yes, click on yes. And I will call on you one by one, and pretty soon I'm going to unmute you all. So can you comment to Steve W. about
LSVT?
Starting and stopping with speech therapy and how that works?
Okay. So, I mean, that's probably unique to every individual, but I would maybe, if you've been practicing your speech, your program every day since you've done LSVT and it's not improving, then I would circle back. And either way, I would circle back to your speech pathologist when you're able to get in with he or she, just to maybe you need a refresher course, or maybe there's some new exercises that have come out since you've done LSVT. These programs are sometimes evolving with research and changes. But like both programs, LSVT and Speak Out, essentially to maintain it, you have to practice their exercises at least once daily for kind of the rest of your life. That's the gist of it. And if that drops off at any point, you might see a setback.
Okay, let's now switch to oral questions that you want to ask out loud. You don't have to type them in. If you're not familiar with the chat box, which in which you could do yes, I don't see anyone clicking there. Does anyone have a question?
If you're on, okay, there you go.
I do too.
And is that Eduardo?
Yes.
Okay, go ahead, Eduardo.
Yeah, I wear hearing aids, and which I use them most of the time. But the interesting thing is that when I'm wearing hearing aids, my wife asked me to talk a little louder because my voice is not as loud. However, when I remove my hearing aids, automatically, without doing anything, my speech is louder. So to me, that tells me that there's still some automated feedback control system that works.
Yeah, exactly. And I think that could be the sensory perception that I was mentioning. So with your hearing aids in, you said you're softer, correct?
Yes.
So you are probably more acutely able to hear yourself with them in, and you might sound almost, it might be that feedback you're getting from the perception you have in your own head. It's similar when we listen to our voices on an answering machine. You know, you hear your voice recorded, you always sound different. And, you know,
Yeah.
when you're in your own head, you sound a certain volume, but the reality is different. So my guess, Eduardo, I'm not an audiologist, but my guess would be it has something to do with that sensory perception of how loud you are and hearing yourself in your own head. So maybe you talk softer because it's too loud when your hearing aids are in, and you kind of are startled by that, or it's uncomfortable. And when they're out, it might be seem more normal to you. Does that make sense?
Yeah, thank you.
Thanks for asking.
If we have any other questions, just unmute yourself with a little microphone, has a slash, click next to it, unmute, and just ask.
And then Rich just came on and he asked if the recording would be posted somewhere later that they could see and view. Yeah. Most likely online on PNMD or the YouTube page.
Yeah, probably both.
Okay.
I'll leave that to Rick. He's the technical one. So
Yeah, but you'll be able to, by going to our website, which is pnmd.net, you'll see almost all the links you need. And it may take us a day or two to get this up. We will post both the slides and as well as the audio visual presentation that Sarah actually did. So you can rewatch it. And then in the presentation, you'll notice that it had a reference to the slide number at the bottom. That way you could look at each slide and then click on the links that she has embedded in the slides. You could spend a lot of time doing this and learning an awful lot.
And then I don't remember, Sarah, did you mention your class on Wednesdays?
no, I didn't. I forgot to make a slide about that. We meet at least twice a month. It's not always bi-weekly. I have a group of 6 to 8 faithful followers. A few I see on the call right now at the moment, Brent and Bobby and Nick. So we meet usually 30, we kind of get chatty, sometimes 45 minutes on Wednesdays, 1 o'clock via Zoom. And if you're interested, you can email me. And Steve's actually new to our group. I forgot to mention that. And so I send out a lesson. We all kind of know the system at this point. We've been doing it together since late January. So I send out a lesson, we do a little warm up, and then we kind of have 2 interactive activities, and then you can practice on your own at home throughout the week. So we do meet on Wednesdays. My schedule is about to change, so I'll notify you all of what days of the month we'll be doing it. But it is usually Wednesdays. And free to all, you know. I think we could probably accommodate a group 12 to 15 at a time, I would say. But after that, it might be tricky. And if we get large, we go into breakout rooms so people can practice in smaller groups via Zoom.
Great.
Other questions that people may have? Well, I have a question about throat clearing. Mm-hmm. Is excessive throat clearing a symptom of Parkinson's?
That's a good question. Did you have it before, Rick?
No.
Okay, so you noticed it since your diagnosis?
Yes, right. Mm-hmm.
Okay, so that could just be related to the dysphagia, the swallowing problems. But with anything, any type of excessive throat clearing, whether it's Parkinson's or allergies or whatever, you don't want excessive throat clearing because that can be kind of damaging to your vocal cords. And as a retired teacher, you probably have already had some history of some wear and tear on your vocal cords as a teacher, because many teachers wear their voices out.
Right.
So what I usually advise folks who find that they're often clearing their throat is to try to take a swallow, and just a dry swallow, if that helps kind of, relieve the symptoms in the moment, or maybe take a sip of water. But the less kind of abrupt that you do, the better for the health of your vocal cords, because it can be very damaging and you can develop nodules, which are like calluses on your vocal cords.
This question has come up before in conversations with people. The question goes something like this, and it's been repeated multiple times by multiple people. Mr. X, Miss X has a very soft voice. I don't want to offend them. How do I let them know that I can't hear them or that they're unintelligible?
So someone's worried about hurting the other
person's feelings. They don't want to make them feel like they're judgmental, especially with Parkinson's. But then again, this is a natural part of the progression of Parkinson's with a number of people. So just your comments on that.
Yeah, no, I mean, I know that is a tricky one, and we live in a kind of sensitive society these days. I would say, depending on the relationship you have with the individual and how close you are, if you feel comfortable mentioning it, it may be worthwhile to provide that feedback. But then again, everyone is going to receive it differently. They may or may not be aware, or they may be sensitive to it. If it's a close to loved one, I mean, I'm very candid with my father when I see changes in his symptoms. So if it is noticed by someone who you're very close with, I would find a way to tactfully address it, or maybe through a significant other, changes that you've noticed. I know it can be difficult, and your perception of it may be very different than those on the receiving end. But just knowing that you have Parkinson's and knowing that you're going to have a harder time communicating, you can be an advocate for yourself and know that you may need to say, hey, I'm sorry, I'm having a hard time with my voice today. I have Parkinson's. And just sometimes being candid and honest, it just takes the elephant out of the room during communication. And other people are more receptive, more supportive, more patient, more understanding, versus wondering like, what's up with this guy's voice? I can't hear him. So I would encourage you to advocate for yourself. And if you see that the other person looks bewildered and is not understanding you based on their expressions, that might be a clue to you as well that there's a communication breakdown happening. So I often say, if you are comfortable sharing your diagnosis, I think people will show you much more empathy and patience, and it will be a better communication experience for you. I don't know if that answers your question, Rick.
Oh, yes, it does. I mean, thanks. I mean, it is a tricky situation, or can be with different people, because it crosses that boundary of the social, emotional connections that we have with other people. And people are reluctant to do anything that's going to make another person feel judged. So there's a delicate dividing line or gradient between judging and helping.
Right. And so sometimes as the person living with Parkinson's, because I'm not in your shoes, but taking that initiative to just say, hey, I'm having an off day with my voice, or, my Parkinson's is really exacerbated today. Like I said, sometimes that just takes the elephant out of the room, and it can make it a much easier dialogue especially when you're somewhere like DMV, which no one enjoys going to, or somewhere like that, where there, you get short, testy communication experiences, and they don't have a lot of patience for you on the other end. That's when I would use your Parkinson's card and say, hey, I'm sorry, I'm communicating the best I can, and I'm living with Parkinson's. And I think that should help change someone's perception of your communication. I would hope that that would change someone's perception.
Some of our people are from Kaiser and have wondered what the procedure is for getting into see a speech and language pathologist. Is it with their primary care physician or via their neurologist, or how exactly does that work?
Good question. I have worked for Kaiser in my career, most recently in pediatrics. I believe your neurologist would be your neurologist would be with Kaiser. I'm guessing if that's your insurance plan. I would start there. And then here, if you live in the East Bay, like many of us do, there is outpatient speech at the Shadelands location with Diana Storty, is one of the longtime SLPs there. There's also Tara Smith. She's out in the Antioch, newer facility in Antioch, that hospital. And then I'm not as clear on the Tri-Valley area of the SLPs for Kaiser over there. But they do offer speech therapy, and they have kind of different pathways. So you would want to get an assessment and see what the speech therapist recommends. But Kaiser does offer speech therapy for folks with Parkinson's. It may not be as customized as LSVT or Speak Out. It may be their own protocol, but I mean, they do offer the therapy.
Can I add something?
Mm-hmm.
I work with Kaiser, and I had a speech therapy appointment through a referral from my neurologist. And I went in person before the pandemic, but I've been doing video calls since then. And they did give me the LSVT protocol.
Oh, great. That's great. Is it out of Oakland or here in our
No, out of Walnut Creek.
Okay, great. That's really good news. I know they are using video visits, and especially during this time.
The Peterson family posted Dr. North, neurologist in San Leandro, is wonderful.
I'm assuming he's with Kaiser. So Dr. North with Kaiser. So that's good to know.
Yes.
Any other questions, Rick?
And she says, Gail.
Are there any others who are seeing speech and language pathologists at this point who might like to share their experience?
And the Peterson family said again, Gail Schwartz is a fabulous speech therapist in the Tri-Valley area.
Oh, good. That's good to know.
Yeah.
How are we going to post these chat notes, Jody?
They'll be recorded, Rick.
I think we have them to be saved, hopefully. If not, then before we close the meeting, then we'll just copy them out just to be sure.
Okay, that sounds great.
And then just to remind everybody that this is being recorded, and oh, sorry, I lost my mic. This is being recorded, and we'll edit it and then post it out and send out an email to everybody so they have access again if you missed it.